And whenever you're ready. Blah, 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 all the way, keep it going, right to the end, Phil, right to the end.
3, 2, 1, go!
Asthma has been misdiagnosed on a large scale for decades. In sport, the ban on inhalers as suspect performance enhancers made the problem much worse.
There was a big upsurge around the time of the Sydney Games of athletes who suddenly thought that because they got a bit short of breath that they had asthma. And it turned out that large numbers of teams where 100% of the athletes were taking asthma medication. Every single person on the swimming team, for instance, for a major country, turned up, boys and girls, all with their asthma in puffer.
But having asthma is certainly no bar to winning gold.
That was when I broke the world record indoors for the 5K. I think I actually lapped Paula Radcliffe twice in that race, so it was her first time of running against me as well indoors.
Liz McColgan, along with the UK's other most famous runner, Paula Radcliffe, had to fight asthma as she developed her career, breaking record after record.
In 1991, I was training for the Barcelona Olympics, and I started to have chest tightnesses and palpitations, and I went into the 10K, and during the race I had like an asthma attack. It was really warm, humid and muggy, and Barcelona's a lot of traffic, and the air sort of polluted more so than in other places, and I think, you know, I was just unfortunate that it actually happened in a major games for me. It was really disappointing in the way that it happened, but you know, because I hadn't experienced it before, I just didn't know what it was, and it wasn't until I went and got a battery of tests that I then realised, you know, it was asthma. I went over to see a specialist in Norway who worked with the Nordic skiers, and he put a camera down into the lungs, and he discovered that all the bronchial tubes had been damaged, and he reckoned that it really was due to actually probably running behind a lot of traffic as a youngster. Keeping it strong now.
Liz McColgan coaches new potential winners at Caird Park in Dundee. Several of her training group have asthma.
2, 1, go!
Right, go, come on! So there's probably about 4 in the group that are on inhalers. Jenny, she actually represented Great Britain, so she's 20, she's an 800 metre runner, she's ranked about 3rd for her age in Britain just now. She's on inhalers, she gets wheezy and things like that.
I've had asthma since I was really young. I think basically when it's cold, the chest starts to tighten, and then I start to struggle. It doesn't really affect me in the summer so much. It's triggered by the cold, I think. It was really bad this winter, obviously, because of the snow. So every time I went out running, I'd get to about 5 minutes, and then I'd get really wheezy, and I'd have to stop and walk and take my inhaler, and then carry on. It was really annoying.
In athletes who have exercise-induced asthma, the cold, dry air irritates the lungs, and it provokes constriction of the smooth muscle around the airways, reducing the airway diameter. This is caused by a number of reasons. One is the dehydration. So when you breathe in air, one of the functions of the airways is to make it moist. And when you breathe in dry air, you get water moving from the airway surface liquid into that inhaled air. And this causes the underlying cells to dehydrate and shrink. And when they shrink, they release mediators like prostaglandins. And these cause an inflammatory response. They cause a swelling that constricts your airways. You've also got to warm up that air. So when you breathe your air in, if you exercise in a cold environment, you actually have to use the small airways to heat that air up. And the repeated damage of this to the airways causes them to become sensitive.
I was diagnosed with it about 9 months ago, but I've always had the symptoms, but I've just never went and got it checked out.
There's a lot of discussion about whether exercise-induced asthma is the same as normal asthma. And in a lot of instances, certainly with children, exercise-induced asthma is the first sign of the development of clinical asthma.
It's gone up, this one. Get up! Terrible, terrible.
Whether in athletes it's the same condition is still being discussed. Most people who have asthma, around 90% of people who have clinical asthma, also have exercise-induced asthma. However, there's a large percentage who suffer from exercise-induced asthma who do not have clinical asthma.
I've been running for about 5 years. I train in all weather, come rain, wind, sun. So certainly in the winter when it's really cold, usually first thing in the mornings when you're going out for your morning runs, certainly if you're doing a session, you have to work harder to get the air in. But I've certainly not experienced any sort of wheezing episodes or having to stop to catch my breath that you get in sort of the more common characteristics of asthma.
Although Angela can find herself short of breath during exercise, she doesn't think she suffers from exercise-induced asthma. But it's very hard to reliably diagnose asthma without the proper tests, which are much more involved than the peak flow measurement that a GP can conduct.
The test we're about to perform is an Evh test, which stands for eucapnic voluntary hypnea. You're hyperventilating on a cold, dry gas, but we're maintaining the carbon dioxide levels when you breathe out. And we do that by having you breathe a gas that has a high carbon dioxide content, much higher than normal air, but the same oxygen content. We're going to measure your baseline lung function, and then we're going to try and provoke a constriction response by having you breathe that cold, dry air for 6 minutes. And then after that, we're going to test your lung function again and see if there's been a difference. You can put that on your nose. So if you can just blow into this whenever you're ready, Angela. That's it. Go, 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 go. Keep going, go, 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 go.
Using the results of the baseline test, a calculation is done to find 85% of the maximal voluntary ventilation, and this will be her target when she watches the readout.
Imagine a really intense running session. Okay, this is the volume of air that you'll be breathing.
She now has to breathe the cold, dry gas for 6 minutes, and even so she has to try to stay at 85%.
That's it, you can see it flicking over. That's where you want it, maintaining that green zone. You've got it, Nick. Come on, push, push, breathe, 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 breathe. And 5, 4, 3, 2, 1. How are you feeling?
All right.
Hard work?
Hard work, that's it.
Then her lung function is tested again to give the final result.
Blow, 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 all the way, all the way. Oh, keep going, keep going, keep going, keep going. Right out, right out, right out.
Just finished the test, asthma test. It was good, interesting, it's hard work. I haven't got exercise-induced asthma, which is quite a relief, I guess, in the main. So yeah, good result. I think a lot of people go to the GP or they experience an out-of-breath experience and they sort of automatically put it down to asthma rather than just being pure and simply out of breath.
What happens is that the individual goes to their GP, they've got a bit of wheezing, the GP has a choice between giving them a trial of treatment, giving them a puffer to go away, which is instant, they can try something out, or waiting for a lengthy wait to go and have some sophisticated tests done at a respiratory unit. Normally what you do is you give the patient, the child, a puffer to go away, and they come back a month later and say, terrific, I've not had any wheezing whatsoever since you last saw me. Now it may well be that the wheezing they had was due to a cold or something else and may have nothing to do with asthma. And so that individual will have a diagnosis of asthma, they will have a puffer, and they will have repeat prescriptions for years and years and years afterwards for no malice or any other reason other than the fact that that was the quickest way to deal with that particular problem when it presented.
The problem with diagnosing again on symptoms alone is there's this belief within the athletic community that inhalers help performance.
And there have been lots of research on what's called beta-2 agonists, which are the common things used for asthma, and there is no evidence whatsoever that they're performance enhancing. They do not improve your performance if you don't have asthma.
So that's why the ban on sports people using most asthma medication was lifted recently. But the idea that inhalers don't help performance at all took some by surprise.
I had a youngster come to me. He'd been on inhalers for 10 years. He was a world champion in his sport, and we performed an Evh challenge, and his lung function improved afterwards. And the difficulty was telling him he had to come off those inhalers because all of a sudden they were a crutch. He was asthmatic. He needed his inhalers in order to perform his exercise properly. He couldn't compete without his inhalers. He came off them, and 2 weeks later, he won world champs again in the sport, which shows that he didn't need them.
In our respiratory clinic, I mean, what we do see is we see normal individuals who turn up with respiratory symptoms. Now, I think that often those respiratory symptoms will be mistaken for exercise-induced asthma. Invariably, actually, they are just exercise-induced breathlessness. Inappropriate breathing is something that we see an awful lot about, and particularly within young kids, is that they don't really know how to breathe. It sounds ridiculous.
All GPs know that you generally treat asthma of whatever type with the beta-2 agonist blue inhaler for instant relief and the corticosteroid brown inhaler for long-term prevention. But the usual emphasis for sports people is on immediate relief, and this is a mistake.
With the beta-2 agonists, I think they're so popular because they work instantly. The symptoms go away. But the research has shown that actually this can exacerbate the condition further if used on a long-term basis, where the corticosteroids, the inhaled low-dose corticosteroids, are working on reducing the inflammation. And it's this inflammation that causes the bronchoconstriction and the remodelling of the airways, which is very important to try and prevent, because in asthmatics, once that's in there, once the eosinophils get in there and release their mediators, then this process seems to be slightly ongoing.
What's really important with asthma is that what we need to do is control it, not use the short-acting drugs in emergency situations. What we want to try and do is make them redundant, because well-controlled asthma doesn't require emergent medication. And I think what we've done is we've re-educated athletes, and what you see now is a lot less of this carrying around the blue inhaler in the pocket and a lot more of using the brown inhaler twice a day and actually controlling it much better. And I think if we can translate that down to the general population and help them understand that this is not about using the blue inhaler, this is about controlling your asthma, stopping it effectively getting worse over time, then that's going to be much more beneficial. And so there is definitely a crossover from sports medicine into general medicine, I think, and asthma is probably a great area for that.
Well, what's important is to distinguish between athletes and general exercising public. Athletes are a special group of people who train excessively hard, maybe up to 25 hours plus a week, whereas the general recommendations for health are about 3 to 5 times a week, up to about 45 minutes each session. Now, this can confer positive health benefits. What we may find is the immune response that an athlete gets from heavy training is very different to what you get with exercising a couple of times a week.
If a child feels uncomfortable when they're exercising, where their breathing is difficult, they don't know that it's any different from anyone else's, but it could prevent them or stop them exercising. And then habits that they form in childhood, they will carry through to adolescence and adulthood, resulting in physical inactivity throughout their life. So it's very, very important to diagnose correctly and early exercise-induced asthma. Whenever you're ready. Blah, 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 blah. That's it. Keep going, keep going, keep going, keep going. You can see you're absolutely borderline here for diagnosis of exercise-induced asthma.
The test that I did today was quite difficult. Results-wise, I probably expected again to be diagnosed with it because I know I haven't been the best with keeping up with my inhaler as such. So I imagine it's a very, very underdiagnosed condition because I say most athletes are quite stubborn and they just get on with it. They think that's what happens.
Exercise for asthmatics is definitely not out of the question. A treated asthmatic, there is absolutely no reason why they cannot exercise.
Sport is actually good for asthmatics, especially running, because you're using the lungs in a very functional way, and I think that it does benefit to expand and to use the lungs in that way when you are asthmatic.
There's a lot of high-profile athletes recently came out saying that they've been diagnosed with asthma. Paula Radcliffe was one.
Okay. Yeah.
David Beckham, I think, said at some point. So if they can get to the top of their game, then there's no reason why we can't just stay fit and healthy and enjoy exercise, enjoy football and what we like doing.